Well, the Arizona Department of Health Services saying this morning there are some changes to test reporting, and that actually drove up the numbers on the data dashboard this morning. It means a lot more tests are being reported as well. So Arizona Department of Health's Director, Dr. Cara Christ, joins us live to explain some of these changes. Good morning to you, Doctor. Where do we start? These are basically updates as you learn more about the virus and testing, and so you have to change the numbers as well.
Absolutely. So today we are adding what are called antigen test results. So these were recently approved by the FDA to be used as diagnostic. We have been working to build the case definition and to build that into our dashboard. Today, we've added antigen tests that go back through the beginning of September, and tomorrow we'll be adding additional cases that go back past several months.
Now, not to be confused, the antigen tests are different than the antibody tests.
Right. So the antigen test is going to look for something very specific on that virus or something that the virus makes. It can tell you if you have the virus right then within usually about 5 to 15 minutes, kind of like a rapid strep or a rapid flu test. An antibody is going to look for your body's defense system against a previous infection with COVID-19. So if you've been exposed and your body made antibodies, then that will show up as positive, but it means that you previously had the disease. You don't currently have it.
So with the antigen test, because you're looking for specific breakdowns, does that mean that we will see a higher number of cases?
So it will add additional tests. We may see additional cases reported more quickly. But what we would look for is not only the number of cases, but the percent positivity. So how many of the tests are coming back positive? Even with these additional 550, 600 antigen cases that we've added today, our percent positivity still went down.
Okay. I watch this every day. I study this every day. I understand it. But the general public, this is somewhat confusing. How do you explain this to them?
So this is just one more test that allows people to get rapid results. And the University of Arizona is using this as part of their re-entry to campus strategy. So they're using it to determine whether people can live in dorms or play football. It gives you a rapid result that you can use to make quick decisions. This is just one more diagnostic test that will be added. I'm sure we will see more as we learn more about COVID-19.
I have to ask you about the recent reported deaths because we've seen a higher number of deaths compared with some of the actual cases. What does that signify and what does that tell you?
So our overall trend in hospitalizations and death is going in the right direction. So sometimes what we will do is we will go back and review previously submitted death certificates to identify anybody that may have died from a COVID-related cause and add them to our numbers. So we would tell people is look at the overall trends, and we are trending in the right direction.
I have to ask you about the R0 because we've seen it increase over the last few weeks. Late July, we were at some of the lowest numbers across the entire nation. We see that creeping up. As it creeps closer to 1, should we be concerned?
I would talk about the trends. So from what we can tell for the R0 model, it's very sensitive to the number of reported cases and the number of reported labs. And then they figure out a percent positivity, not the way that we do it, but based on those reported numbers. It's very sensitive to that. So I would say probably based on the increased cases today, I would anticipate that the R0 is going to go up tomorrow. And then potentially the next day when we add those additional cases, and then again, trend back down. But really important to look at the overall trend over a couple of days to weeks versus very day to day.
Doctor, people are worn out. They're tired of COVID-19. Some people think it has just disappeared. What's your message to them?
I would say that we're definitely trending in the right direction, and Arizonans have done such a great job at wearing their masks, staying home when they're sick, and physically distancing. So we've been able to bring down our numbers and the number of new cases. What I would caution everybody is that we know it's still in the community, so we need to keep doing those same steps. So making sure that you're wearing the mask when you are out in public, and really important, especially with flu season coming up, stay home when you're sick and get your flu vaccine.
All right, thank you very much for updating us and explaining what is sometimes confusing to a lot of people out there.